A new pilot program will see patients in the West with complex chronic conditions get help at home from retired nurses and trained community carers after leaving hospital. The initiative by Fong General Hospital and social service agency Loving Heart could eventually be scaled up across Singapore. Sabrina Ng reports.
I'm Ranjit, calling from Fong General Hospital.
A reminder to take medication or simply helping a senior stay active are some ways community carers can support patients after they leave hospital. But the impact of such support can be big, helping prevent patients from deteriorating and returning to hospital, easing pressure on space for acute care. That's as Singapore's ageing population adds to healthcare demand. MP for the area Grace Fu says Jurong East is one of the country's oldest areas, with about 5,800 seniors in Yuhua alone.
There are so many amongst us that are living in this area that will need the help. And also to help us free up the very critical hospitalization capacity in our system, because our hospitals are doing their best to treat those with acute illnesses. And in order for them to direct their resources to the most acute cases, they have to have partners that will help them free up the less acute ones.
Fong General Hospital's new program will support around 1,000 patients in the West over the next 2 years. It targets those with complex chronic conditions, such as kidney, heart or liver failure.
How are you so far?
Retired nurses will identify patients who need more help after discharge, while trained community carers will follow up with them at home. This includes medication reminders, blood pressure and symptom checks, and helping them keep up with appointments.
People who, if they don't follow their medicines, if they don't follow the advice of the doctors and nurses after they come home, they can actually get worse and they can actually end up readmitting and staying in hospital again. And we want to prevent that if possible. So I think community carers play that role when they are back home to close that gap, right? Where they can actually, I suppose, continue recovering, rehabilitating, and then get back and reintegrate into normal life in the community again.
Fong found that among patients readmitted within a year, 68% returned unexpectedly at least once within 60 days of discharge. Poor social support and failure to keep up with medication and appointments were among the main reasons. But an earlier trial involving 200 patients found structured follow-up cut 60 days readmission rates from 40 to 31%. 25 community carers will initially be trained to spot signs of deterioration, and more could be roped in eventually.
When we are able to show that this succeeds, we can then compare notes with all our counterparts across both hospitals and UHS and Singapore, pool our knowledge and learnings together and be able to develop a better system for all our patients.
For seniors, the aim is ultimately simple: to help them stay well at home for longer.